Today we're teaching the inner workings or maybe outer workings of a suture package. So a suture package has a ton of information on it that's useful for you when you're trying to select which stitch. First of all, if you have a non-absorbable suture, you can actually see in the package and see the size of the thread. The next piece of information I want to point out is the needle. There's two things you see here. First, you see a true to scale representation of the needle, and then you see actually a cross section of a needle. So this needle is called an SH, stands for small half. The dot within a circle, it means that the point is at the very center of the needle, and the needle otherwise is round on its outside. Let's compare that to this Vicryl that I opened up earlier here, and this is actually a conventional cutting needle, which basically means that the cut is on the inside of the needle, not on the outside. That would be considered a reverse cutting needle. And this basically allows for it to cut the tissue as you pass it through, which makes for a smoother pass. The next piece of information is we oftentimes will have a number and then a bunch of O's. And that actually is a representation of the number of O's that this system is using. And the more O's, the smaller the thread size gets. So it starts as 1 O, 2 O, 3 O, and these are 3 O, and it can go all the way up to 6, 7, 8, 9, 10 O's, 12 O's. Compare that to this stitch that I haven't opened, and that is a number 5 Ethibond. I'll open up really quickly so you can get a sense. You can see that the thread here with this number 5 is incredibly thick. So this is not 5 O's, this is actually number 5. So on the other end of the scale, as it's getting smaller and smaller with the more O's, once you hit 1, 2, 3, they become much bigger. Typically though, most of the stitches we're using, at least in general surgery, are from O down smaller, although sometimes we'll use number 1s or number 2s occasionally. Number 5 like this is typically used in orthopedic surgeries to repair tendons. Suture factors will have the length of the stitch, in this case 35 centimeters, in this case 45 centimeters, and it'll have an indication of what type of material makes up the stitch, like silk in this case, which is non-absorbable, and Vicryl, which is an absorbable stitch. So now you know all the outs and ins of a suture package.